No, you cannot be called a driver without good eyesight. Do you know that those with poor vision have a 30% higher incidence of road accidents than those with clear vision? Do you know that proper eye care now will help you see well and clearly into old age? Do you need more information on how to take care of your eyes? Then Eyes on the Road is the program for you, your friends and family. Yes, Eyes on the Road on Lagos Traffic Radio 96.1 FM is a program designed to help educate listeners on the best practices that relates to eye care so you are better equipped on the health of your eyes for optimal performance. Join Dr. Priscilla Imade, Doctor of Optometry with a PhD in Public Health on Eyes on the Road, 4:30 p.m. to 5 p.m. this and every Thursday on Lagos Traffic Radio 96.1 FM. Eyes on the Road, your safety our priority.
We are the dial that helps you navigate through Lagos traffic with ease. We are the 96.1 dial. Lagos Traffic Radio 96.1 FM. Moving Lagos forward.
And a wise man said, your vision is your safety. Guide it always. Good afternoon, dear listener. Welcome to your weekly Health Tonic show on radio, Eyes on the Road, your go-to show for expert eye health insights. Of course, this show is proudly brought to you by Lagos Traffic Radio 96.1 FM. And on the show today, we shall be taking a look at the eye condition called pterygium. You'll be wondering that this is a big word. What's it all about? We'll be breaking it down, and from a bit of my own research, I discovered it's sort of a benign. Okay, that's still big grammar. It's a benign wing-shaped growth of tissue, often seen on the eyes. I'm sure you've seen this, and sometimes people mistake it for cataract, but it's actually not cataract. So on the show today, we'll be looking at what risk factors are, what the symptoms are, and of course, who is at risk of having this kind of issue. So taking us to the classroom today to further explain in details is our very own eye expert here in person, not via phone line, Dr. Priscilla Imade, to enlighten us on the aforementioned and preventive measures. I remain your host, Akan Usen. Join us on this ride and let's get right into it. All right, so straight away, and I'll be handing over as I hand over to Dr. Priscilla Imade. Just to let you know that shortly we'll be giving you traffic feeds. Of course, we talked about the Ikeja axis, where things are still looking quite fine from the last update. Of course, we'll be giving you more updates as regards this, but the state of things at this time, it is still looking fine all the way down, except of course around the lower where it's busy, the Aromire end, and points like that. But we'll definitely bring you updates as regards that. But talking about pterygium today, Dr. Priscilla Imade, what is it all about? Great to have you on the show, first of all.
Thank you very much. I came in person.
You're always stunning us with different shades, different eyeglasses. It's like you have a lot of. How many pairs do you have?
I have many. I just wear to suit my mood and then to suit the color of my clothes.
Interesting.
So I have eyeglasses in practically every color.
Every shade and color.
I'm sure if I count my glasses, they should be up to 50 or more.
Wow. Wow.
Of course, that's what I do. If I were to be a fashion designer, wouldn't I be wearing different kind of clothes?
True.
Yeah,
True.
Of course.
True.
You get to see it on me first,
Indeed.
And I'm here to keep you too.
All right.
My bishop.
Our producer in the background. All right, so let's go into this. Pterygium.
Yes.
First of all, the spelling is tricky. P-T-E-R. You know, that has...
what is P doing there? That's the
yes.
question.
You know, I know it has Greek origin, so to
Yes.
say. You know, but doctor, what's the meaning of... What does it mean?
Pterygium. Pterygium is just a growth, a benign growth, like you said, on the eye. Okay, had it be we are opportune to visualize this, it will, I'm sure our listeners would have appreciated it more. But just try and reason along with me. If you look at the image of the eye, the outer part of the eye,
Yes.
we have the black and then the whitish part. Now, there is a transparent membrane called the conjunctiva that lines the whitish part of the eye. It does not line the black part, it lines the whitish part of the eye. The whitish part of the eye is called the sclera.
Okay.
It also lines the inner eyelid, the upper eyelid and the lower eyelid. The conjunctiva lines them as well. So this conjunctiva is a transparent membrane. When it becomes inflamed or is infected, it will be red. So most times, if you see the eyes as being red, it's actually the conjunctiva. Most times that is infected or inflamed. That's why we say somebody will have conjunctivitis. Exactly.
Okay.
Anytime you hear TIS, it's referring to inflammation. So conjunctivitis, iritis, depending on the structure, we just name it according to the structure. So that conjunctiva that lines that sclera part of the eye, ordinarily you don't see it because it's transparent. It's the whitish part you see. Now, in some people, due to certain factors that we're going to discuss later, you find this pound of conjunctiva now being unnecessarily pronounced, raised, accumulated on a particular spot, and then most times you now find things, other tissues like collagen, debris, intertwined with it. It's like trapped within it. I'm just trying to explain it in simplest of terms so that our listeners can visualize with me. So it will grow from the part of the eye that is closest to your nose, that triangular portion, we call it the inner canthus. It's going most likely grow from that place, and then it will be moving like a triangle with the mouth pointed towards the black of the eye, the blackish part of the eye, called the iris or the cornea. Because the cornea too is another transparent membrane that overlines the iris.
Yes.
The iris is the black of the eye. So pterygium is not cancerous.
Okay.
It's just a growth.
So that's why
we
I was
say
going to
it's
ask benign. What's the meaning of benign?
It means it's not cancerous.
Okay.
So it's just accumulation of debris, dirt, different tissues, intertwined with the conjunctiva on the eye, those tissues, and then they start growing towards the black of the eye. There was a time I had a patient that called me. I said, doctor, she came and said, doctor, I have cataract in my eye. I have cataract in my eye. By the time I checked, I said, this is not cataract. He said, no, the thing is growing, because in some people, you actually see it will grow even to the point of the pupil.
Wow.
Yes, also in the black of the eye, there is a smaller portion at the center of that black that is called the pupil.
Yes.
So in some people, the pterygium will so progress.
All the way from the outside?
Yes, all the way from the outside. And then when it's inflamed, you see it as a mass of tissue on the eye. It can be very irritating, can be very annoying, it can be very disturbing. So,
but will it affect the sight though?
Yes, if it progresses into the cornea, it's going to affect the way we see. It can lead to blurry vision. For some people, it can even start blocking the pupil. Actually, the light rays will pass through the pupil for you to see.
Yes.
It can distort the cornea, the shape of the cornea, resulting in astigmatism for that patient. So somebody that did not have astigmatism before, because pterygium has grown and protruded onto the cornea, can distort the shape of the cornea, making the person look like he has astigmatism. Yes, astigmatism too is also a type of refractive error. We talked about refractive errors before. Talked about long-sightedness, short-sightedness, and of course astigmatism. And of course, there are 4 stages of this pterygium. There are some, it will start growing. When it just start growing, it will still be maybe before the limbus. The limbus actually is the junction between the black of the eye and the whitish part.
Okay.
So if the pterygium is just around that area, most time it does not really bother anybody at that point.
Oh, doctor, we seem to have a call. Let's see if we can take this. Hello, good afternoon.
Good afternoon, Dr. Aka. How are you?
I'm fine, Grandpa. Good afternoon,
Grandma.
ma.
Great to have you with
Compliments.
Good afternoon. Dr. Imade, good afternoon, ma.
Good afternoon, Grandma.
Yes, nice hearing you this afternoon.
Thank you.
On Sunday, somebody was telling me her experience because I said it's a long while I've not seen her. So she was saying that she couldn't go out because she cannot see very well. It's like the ground is going higher, lower, higher, and then things will be very blur. And she has to keep a book very close to her eyes. So I was not telling her. She said somebody said it's cataract. I said, don't let somebody who is not a doctor speak for you. So I now said, you should come to your place. I describe your place to her. That, no, you should go. I hope it's not that one that we call the blindness. Put you. So I said, go on Monday, go, since you cannot see, she cannot walk.
Wow.
You carry her leg up and down like this. I said, and you stage a young girl with kids, you won't go blind. So I'll describe your place to her.
Okay. So after the program, just send me her name. I can follow up.
What symptoms is that, doctor?
That one is serious. So she has to come so that we'll examine the eye, so that we'll know exactly what is causing it. I don't know how old she is or if she has diabetes, hypertension, or there are other factors. Let her just come. We'll examine her. Now I'll give you a feedback.
So, doctor, talking about you mentioning diabetes, so could that be like a pointer to something else happening
diabetes
right there?
Complicates any problem in the eye.
Okay.
It's a secondary opportunistic problem in the body that will spoil everything. In fact, it will look like the problem is almighty. Diabetes is not good though. Anybody that has diabetes,
all right,
as much as possible.
So thank you very much, Grandma, for calling in. And the phone lines, well, she already preempted us. 091-538-77127. Do call in. Would love to hear from you. If you have any eye question, eye concern, eye challenge, feel free to connect with us. You could also send a WhatsApp message, 080-991-20777. Would love to hear from you. We're talking pterygium today, and doctor has already taken us to the classroom to let us know. We have a call. Let's see if we can take this real quick. This is one from one of our regulars. Hello. All right. We seem to be having a bit of a challenge with the audio, but that's Elder Tewa, but they do call back so we can get that call. Back to you, doctor.
Okay. So still talking about pterygium, there are different stages. The first stage is when it's just starting. It has not gotten to the limbus. The limbus is the junction between the black of the eye and the whitish part. If you look at your eyes in the mirror, just at the point where the intersection between the black and the white, that's what we call the limbus, or the intersection between the sclera and your cornea, or the iris, more to say. So for some, it can also extend just a little into the cornea, and then pterygium too can also actually progress to the pupillary area of the iris, and then sometimes it can just project into the pupil itself. Once it starts entering the cornea, that's when we actually start talking about doing a pterygium excision. If it has not,
just as you're talking, as you're explaining, help us, using our layman's English, so we will understand the seriousness of this thing.
It's serious, and it's very common around here. Like almost everybody in Nigeria.
Averagely, yes, I was going to say
or
it.
the other, and there are a lot of reasons for that. So one of the causes is our sun.
Oh.
Anywhere there is sun, people there, yes, would have it like 90% or more.
What's the cause? Is it the sun's rays? Is it the ultraviolet rays?
Yes.
What's the cause?
UV light. We have UVA, UVB, infrared, different rays from the light. The chronic exposure to this ultraviolet lights actually, will make pterygium.
So that means people who work in the sun, say people that stay in the sun.
Almost all of them. When I screened drivers.
We have Elder on the line. Hello.
Dear doctor.
Good evening, Dr. Ogbade. Nice to hear your voice.
Thank you very much. Thanks for the weekly bonus you used to give us.
Thank you so much.
On this group you are talking about, is it right from the youth that this thing happens?
Okay.
Or at a certain age?
Okay. Yeah, thank you so very much. In fact, I tell that Bade just, moved ahead of us. I'm actually coming to the risk factors for that.
Okay.
So, among the causes, wind, dust, smoke, environmental conditions, even this ozone layer depletion now is also being implicated.
Wow.
The irritation from outdoor pollutants, people who are always outdoor, industrial environment, people that walk around sawmill, people who work in areas where the air is polluted, they will always have it. Pollution from automobiles, from industries, from all sorts will actually make pterygium to grow on the face, because they are like debris, and your upper eyelid acts as a wiper to cleanse. And then if the tears, they are not nutritious enough and your eyelid is not able to wash it enough, you just discover that over time.
How do you mean nutritious? The tears.
That's why nutritious. We tell you, listen to this program so you know how to take care of your eyes. You don't know that the tear itself is like the food of the eye that helps to clean, nurture your eyes so that you can see very well. Once your tears are compromised, your vision will be blurry. Okay, risk factors, quickly to answer that. This question. Age is a major risk factor. For most people, from about the age of 30, you start noticing it, 30, 35, 40. At about those ages too, you realize that actually the strength of your eye or the health of your eyes too starts reducing. The immunity of your eyes start reducing. So that's why it's also more rampant at higher ages. The higher you go, yes, the more the one is exposed to pterygium. Outdoor occupations.
All right, doctor.
Farmers.
Let's see if we can take this real quick. Hello.
Hello. Good evening.
Yes, welcome.
Yeah, please. I just want to ask the doctor.
You didn't tell us your name. You didn't tell us your name and
my
where
name
you're
is Festus Akitola.
Okay.
My name is Festus Akitola.
All right. Please go on.
Festus Akitola is
Yes, please go on.
Festus Akitola is my name.
Okay, please go on. Go on.
I just want to know when I can meet the doctor in the office.
Okay.
It should give me a specific time that I will meet her in the office. Not that I will be saying he has not been in the office, he's coming. I want a specific time that I can meet her in the office, please.
All right.
That's all.
Let the doctor respond immediately.
Okay. Every day we are open. If you want to see me personally, my consulting days most times are Tuesdays, but I'm virtually there every day. Offline, we can talk so that I can tell you when you can agree on a time to come. But I'm virtually there every day.
So we'll definitely be dropping the number at the end of the show. So just stay tuned, and we'll definitely give you doctor's number. But she has already mentioned that she will be available Tuesdays, but every other day is virtually around. Let's quickly take a look at the traffic situation at this time. Okiodo axis. Presently, traffic is still looking good, and of course, not taking away from the fact that return journey influx is something to be expected, but it's still looking friendly now. Ilekbo, Super, Ablegba, Awori, connecting Ijaye, Kola, Mashlashi, all the way through to Ajegunle at the moment is still good. There was an earlier reported impediment at Ilekbo, that's a low bed truck. Well, that has finally been moved off the road, and the overnight loaded pipe truck has not been moved off yet. It's still there, but we have traffic managers on the ground doing the needful. We're giving you more eye-opening traffic updates, but meanwhile we're talking pterygium. We would love to hear from you. Dr. Priscilla is here dishing out the knowledge and the solutions. Yes, 091-538-77127. That's the number to call. 091-538-77127. Then if WhatsApp is your choice, your medium of you could go 080-991-20777. All right, doctor, pterygium, how does this relate to driving, the driver's test?
Okay.
Do they check out for this? And does it have any correlation or any effect?
In fact, all drivers in Nigeria are at risk of developing pterygium.
Okay.
Drivers that are exposed to that always wind down their vehicle, and then a breeze, natural air gets in contact with their eyes. Those two who also are under the AC, they are also at risk.
So
yes, because your eyes are constantly exposed. The ones who don't have AC in their car, that one is worse. So the risk is higher because
put AC.
AC is better.
Okay, AC is better.
AC is better.
Okay.
We are just looking at risk factors. Some risk factors are higher than others.
Okay.
Now, all people that do all kind of outdoor works, and it's more predominant among males, because males are more, although women are working now, are more outdoor than men.
Yeah.
Road workers, road construction, fishermen, farmers, food vendors, all these women that are cooking with firewood, smoke.
Yeah.
Anywhere there is smoke, any type of smoke at all.
Well, like in those kind of cases, what do you think those kind of people can do? Like with smoke
you go to
and all that?
countries, you protect your eyes whenever you are doing any job that puts your eyes at risk. Have you not seen cooks? They wear these protective
goggles
on their eyes. Yes. So those are the things. I've seen welders who weld without even wearing anything. They just go about and they are doing it. Okada riders. I did a study on Okada riders, in Lagos State. I discovered that quite a number of them. In Oyo, I did a study for people who work in the sawmill, all of them. So repeated exposures to all these particles will make pterygium, to grow in the eye. And then the symptoms usually is redness and inflammation. You'll find out that these people that are repeatedly exposed, their eyes are never white. If you are a driver now, check your eyes. Are your eyes white? That's where it starts from. They will now be having, over the years, they are the conjunctiva, now makes the sclera to look brownish in a way. And then sometimes you start having some, pigmentary spots around the eyes. When that also happens, some people would have what is called foreign body sensation. It will look like there's sand in your eye. Every time you feel like you want to scratch your eye, it's as if something is in your eyes. Pterygium can make you have that feeling, and then it can affect your vision. You may not be able to see as much as you see. Cosmetic concerns. People who have pterygium cannot use contact lenses. Cosmetically, their eyes, because they are always red, they will look one kind. People will look at your eyes, say, what's wrong with your eyes? And there can be complications due to astigmatism or corneal distortion, vision obstruction, and recurrence even after surgery. I also find out that some people, when they want to do it, they just go to local places, just like some people do couching and all that. We don't encourage that. When we want to do pterygium excision, now we do it what we call autograph. It may cost you a bit more, but when you do that, the pterygium will not grow back. So part of the treatment is to use lubricating eye drops. When you come to the clinic, we assess the pterygium, and then we can give you anti-inflammatory eye drops if the eyes are inflamed, or surgical excision in cases where it has started affecting the vision or has really, really progressed into the cornea. One of the ways you can prevent pterygium is by wearing UV protective glasses. Protective glasses. Real UV protective glasses, they are very expensive. It's not this one you buy by the roadside. They just write UV. You think it's protecting, or dark shade you think is protecting. No, there are different wavelengths and different UVA, UVB that you have to protect. So when you're able to protect your eyes from this, it's going to help you a lot. And then if you walk in the sun every time, please, you can wear a hat or have a shade over your head. Don't just expose your eyes or your skin to the sun every day. Avoid prolonged exposure to dust and wind. And this also brings me even to the issue of our last man and other security agents in Lagos State. Sometimes when I pass, I see them under the sun. I feel a lot of pain in my heart, and I'm like, what can we do to really help them, because over time, this repeated exposure to the sun
But what can be
is going
done?
to put them at risk.
Any
I
recommendations?
can put up a proposal to that effect. Let's see how we can help them.
Yes, they do wear hats.
It's
and
not
all
all
that.
of them that wear the hat, and if you are going to wear hats, it will be a hat that will cover your head round, because some of these rays can also come in from the sides as well. And you know the sun, especially from that 12 till about 3, 4.
It's really strong.
Yes, it's really strong. From about morning till 11, it's a build my bed. That during that hot, if there are ways we can, tamper their work down at that period. Maybe after they have done the heavy one in the morning, during that time, the traffic lights can be on.
I know in some places you have this shades that's constructed by, like where they go there.
Most time they are out because
in the open sun.
In the open sun. So these things, and even after they finish this work, when they retire, the side effects too, they're also waiting for them in future. So I think we can actually look for ways to mitigate this, so that what we call occupational hazards or the after effects at retirement of these jobs that have been done will not actually tell on their health and reduce their longevity. So there are a lot of public health concerns. I'm a public health advocate. That's actually why I brought in this LASMA and other agencies that are responsible for controlling traffic. Well, there's a lot we can do. And lack of awareness and poor access to eye care can actually delay treatment or lead to, repeated occurrence of, these diseases. I just think that if we keep educating ourselves, if you are aware of something, if you know what you are to do as far as your eye health is concerned or your eye care is concerned, you become intentional. But when you don't know or you don't have sufficient information as per the right decisions to take,
yes,
one can be doing the wrong thing. And that's the purpose of this program. I've always said here on radio that I'm your advocate for the eradication of avoidable blindness in Nigeria. I've taken it upon myself as a ministry to educate as many people that care to listen to me as far as eye care is concerned, because the World Health Organization has done a study on Nigeria, and they said 80% of the causes of blindness in Nigeria are preventable, they are avoidable, they are treatable. So for something that can be avoided, something that can be prevented, something that can be treated, why should we now have that huge statistics hanging down on us when we can do the right thing? And if we do the right thing, we can actually, stay off such a statistic. So that's why I'm bringing this message, that nobody should go blind. And actually, we are saving sights and changing lives.
Saving sights, changing lives. Indeed, it has been a very eye-opening time on the show today. And well, dear listener, thank you so much, for tuning in and just giving us your attention. We appreciate you so very much, Doctor. We have run out of time. I wish we could go on and on and on. I know people have a lot of questions, on this, but of course you can always send them via our WhatsApp channel. Would definitely love to hear from you. Thank you so much for taking time out of a busy schedule, Dr. Priscilla Imade, to come give us some much needed knowledge. That no one should go blind is our main reason for painstakingly bringing you the show every Thursday around this time. Remember, every early action stops any kind of eye illness. So please do well to go for regular checkups and complain when you have any discomfort from your eyes, because it's gonna save you a lot. Now, if you missed any part of today's show, you can go back to our Facebook page, Lagos Traffic Radio 96.1 FM, our YouTube channel, Traffic Radio 961. Search for the keywords Eyes on the Road, and don't forget, when you're at it, don't watch alone. Share, share, share. Dr. Priscilla Imade, OD, MSc, PhD in Public Health, consultant optometrist at Modern Eye Care Foundation, and a fellow of both the American Academy of Optometry and the Nigerian Optometrists Association. Multiple award winner, and I can go on and on. If you want to reach out to her, please call 080-3333-6672. That is 080-3333-6672. The clinic is situated at plot 16 to 18. That's Modern Eye Care Foundation. Plot 16 to 18, Ogunusi Road, opposite Omole Estate, Phase 1 by Akiode Bus Stop, Ojodu Baja. On behalf of our production team, led by Micah and Rocha, with assistance from Bakari Kausara, and not forgetting Temilade Uluwatosin, and our executive producer, who of course is Tayo Akole. My name is Akan Usen, telling you that eyes on the road, your safety, our priority. Lagos Traffic Radio. See you next week.